Hi everyone, I'm Sara and my group members are Khalilah, Sara, and Lena, and today we're going to be talking to you guys a bit about Gaba and anxiety. So I'll start off with a little introduction. So firstly, for those of you who may not be aware, anxiety is a feeling of unease or discomfort, and it can be either severe or mild, and it is your body's natural response to stressors. Everybody experiences anxiety to some degree in their lifetime, but some who feel it more severely are diagnosed with an anxiety disorder, and they have treatments and methods to help cope with it as it interferes with everyday life. One of those tools is called GABA supplements. So GABA stands for gamma aminobutyric acid, and it is a chemical made in the brain. So GABA supplements are taken orally under the tongue and helps reduce PMS. It can also help with ADHD, and it promotes muscle growth, fat burning, pain relief, and stabilizing blood pressure. Sorry, and more importantly, it reduces anxiety. So it's a neurotransmitter found in the central nervous system, and it binds onto neurons and it reduces their activity. So it works by blocking brain signals or neurotransmitters by putting a wall between nerve cells and the brain. So low GABA in the brain is related to many things, such as epilepsy, mood disorders, chronic pain, and anxiety. So the proper dose for those things has several factors, including the patient's health, and it needs to be taken up with the doctor themselves to assess the correct dosage. So I'll let my friends continue with the rest.
So to start off this video, I'm going to talk a little bit about what anxiety is in general. So the definition of anxiety is a state of unease caused by the apprehension of a potential danger. So basically, anxiety is manifested through signs of physical tension, and when this state takes place, it is very mentally overwhelming, which as a result can make it quite difficult to concentrate on other things around us. Some of the symptoms of anxiety, according to the Mayo Clinic, are a feeling of being tense, restless, and nervous. You can experience hyperventilation. You can feel a sense of impending panic or doom. Usually, your heartbeat increases. There can be trembling, feeling too hot and sweating, feeling tired. There can be a loss of concentration, having trouble with sleep, and having gastrointestinal problems. It's important to note that there is a difference between experiencing anxiety and having an anxiety disorder. So everyone will experience anxiety in their lifetime because it's a natural way for our bodies to protect us. This mechanism is actually vital in an adaptational sense due to its cautionary nature towards unknown situations. So, in other words, it's pretty important for our survival. Anxiety is the result of fear that is caused by drawing our attention towards an unpleasant situation, which is the potential danger, and then creating a strong response. So, the emotion that is felt is very intense because the danger that we're perceiving is usually amplified in our minds. On the other hand, in the DSM-5, anxiety is recognized as a disorder when the anxiety and all the symptoms related to it cause considerable negative impacts in all spheres of life. So, someone with an anxiety disorder will have an excessive amount of worry about any normal situation that are usually quite common. So, the state of feeling anxious is no longer occasional, and it does not simply leave after a short amount of time, it becomes very persistent. So, an anxiety disorder can lead to unexpected and intense episodes of terror that last a very short amount of time, and these are called panic attacks. So, there are also many different types of anxiety disorders, such as agoraphobia, separation anxiety disorder, social phobia, and there are many more. There are many potential consequences to having an excessive amount of anxiety. In fact, an anxiety disorder can lead to things such as depression, insomnia. It can lead to suicide, chronic pains, headaches, substance abuse, digestive problems, even social isolation. So, overall, it just can lead to a poor quality of life. So, that's why it's so important to try to find tricks to calm yourself down when there's a stressful event or when you feel panic. And it's also really important to get help when it is needed.
Hello, my name is Sara.
In this part of the video, we'll discuss GABA and the role it plays in anxiety. The amygdala is involved in anxiety. Many distinct groups of nuclei compose the amygdala. However, we'll only talk about two: the basolateral amygdala complex, the BLA, and the ventromedial amygdala complex, the CEA, because they play an important role in anxiety. The thalamus and the sensory association cortex notify the BLA of threatening stimuli. Then, the BLA activates the CEA and the bed nucleus of the stria, the BNST. The CEA and the BNST signal the hypothalamus, the brainstem, and the basal forebrain. Activation of these brain structures induces the manifestations and dysphoria that's tied with anxiety. When the BLA activates the CEA and the BNST, it also activates GABAergic interneurons. The GABAergic interneurons hinder the activity of the CEA. The GABAergic interneurons ship GABA neurotransmitters toward neurons of the amygdala. GABA neurotransmitters are inhibitory neurotransmitters because they calm down overly excited neurons. There are two types of GABA receptors: Gaba A and Gaba B. When GABA latches onto a Gaba A receptor, a chloride channel opens up. This allows negatively charged chloride ions to flood into the neuron. This makes the membrane hyperpolarized and therefore less likely to fire an action potential. When GABA latches onto a Gaba B receptor, a chain effect causes a potassium channel to open up. This allows potassium ions to rush out of the neuron. This makes the membrane hyperpolarized and therefore less likely to fire an action potential. Usage of GABA A receptors is more rapid and faster. GABA A receptors are ionotropic. Usage of GABA B receptors leads to slower and longer inhibition. GABA B receptors are metabotropic. In conclusion, GABA reduces anxiety by making neurons of the amygdala too polarized to fire. GABA and or other medications that encourage the bonding of GABA to GABA receptors are useful for treating anxiety.
My name is Lena. For this presentation, I found an interesting research that also opened a new twist on GABA. It is an article which is called Neurotransmitters as Food Supplements: The Effect of GABA on Brain and Behavior. GABA is widely known as a food supplement, so much so that in Europe it considers it to be a food constitute, while in the United States it considers it to be a dietary supplement. It is possible to get it online on various surfaces such as Amazon, Wish, eBay, and so on. If you want to search for their products online for the purpose of making a purchase, You'll find many positive reviews left by previous buyers. The sale of this product is possible if the manufacturers do not make any declaration on the benefit that this product could have on a disease or medical condition. This article seeks to answer the following questions regarding GABA food supplements. Is GABA able to cross the blood-brain barrier? Do GABA as a food supplement exert an effect through peripheral effects outside of the brain? Does it rely on a placebo effect? The blood-brain barrier is an important element for our brain since it protects it from harmful substances such as toxins, abnormal ions, etc. There are various research that debates the permeability of the blood-brain barrier. However, this discrepancy is due to various factors. Firstly, they do not use the same chemical compound when it comes to GABA. Secondly, they do not use the same method of administering GABA, whether orally or by injection. Thirdly, the tests are only done on rodents since we have not yet succeeded in analyzing the level of GABA that humans have alive. This is a factor since humans and rodents do not have the same amount of GABA metabolism. In the article, they mention several researches that support the claim customers made of the beneficial effect that GABA food supplement brings to them. However, I will just introduce you to two. In the first study, GABA food supplement was administered to two groups, a healthy group and a group of participants with a history of acrophobia. During this study, they discovered that there is an increase in alpha waves in the first group and a decrease in the levels of immunoglobulin A, which is an indicator of human system functioning, in the second group when exposed to lights. In the second study, they found that the group administered GABA food supplement had a decrease in heart rate variability and salivary chromoglobin A when participants performed an arithmetic task, compared to the second group, which was administered GABA-enriched chocolate. Fun fact, a person would need to eat 2.34 kilos of uncooked spinach to consume the same amount of GABA, even if spinach is known to be rich in GABA compared to other foods. However, these studies are not 100% reliable since one of them was affiliated with a company that produces GABA food supplements, and others did not want to declare whether there was a conflict of interest or not. If we look at other possibilities by which GABA food supplement would have a beneficial effects on us without necessarily having to cross the blood-brain barrier, one hypothesis would be through the enteric nervous system. In simple words, if we take orally a GABA food supplement that has a similar strain as a bacterium that contributes to the formation of GABA in the enteric nervous system, it could influence GABAergic firing in the mice brain through the vagus nerve. However, the link between the oral administration of GABA, the vagal nerve, and GABA levels in the brain has not been established. It is a hypothesis. In conclusion, we cannot conclude if these supplements sufficiently reach the brain in enough amount to have a biological effect.
So, in conclusion, we find that it's very important to just to be refreshed about the things that you've just learned. So, anxiety can be very mentally draining, making it very difficult to concentrate on other things going on in one's life. And experiencing anxiety is not the same as having an anxiety disorder, and that is very important to keep in mind, as anxiety disorders are much more severe and persistent, and they can lead to things like panic attacks, as we've mentioned before. And so we just wanted to let you guys know that it is very important to seek help and find ways in which to cope with anxiety if needed. And so we also learned that the BLA and the CEA play an important role in anxiety, because when those are activated, they induce manifestations that are tied with anxiety. And the GABA reduces the anxiety by making neurons in the amygdala too polarized to fire. We also discussed how GABA is widely known as a food supplement or a dietary supplement and can also be purchased online on things like Amazon and stuff like that. So yeah, that was just a quick recap. If you guys have any questions, please feel free to ask right now. Any of us would be glad to answer. Thank you so much for your attention, and I hope you guys have a lovely day.